And I'm going to give you an idea of where we're headed with the 6-hour course. This is a 6-hour course, but it's going to be broken up into 3 different, approximately, give or take, 2-hour sessions. So that's our format. The first session, the first 2 hours, which we're obviously jumping into right now, is going to look at just kind of some overview stuff to begin with. We're going to look at the overlap of trauma and addiction, kind of the relationship of trauma and addiction, and why those two phenomenon have been started to being discussed together. Then we're going to get into some of the specifics of how we identify them. So we're going to look at what is a trauma. We're going to look at PTSD, which, by the way, are not inherently the same things. They're obviously very related ideas, but not completely the same thing. But they're obviously related. And then we're going to look at the idea, maybe briefly, of dual diagnosis, so treating co-occurring conditions in terms of PTSD and addictive behavior disorders. And we're going to get into our foundational approach for our model. Again, this is a CBT training, or a training on cognitive behavioral-based approaches. Anyway, it is cognitive behavioral-based approaches to trauma and addiction, but we are going to cover our foundational pieces of our model. So we're going to look at traditional CBT, and we're going to look at some DBT, some dialectical behavior therapy, and some schema therapy, which we use as sort of adjunctive in our broader cohesive cognitive model. So we're going to do that in this first session. Session number 2, then we're going to get into some very specific CBT-based interventions. And we're going to really explore the cognitive model of addiction and get into that in a bit of depth with you in session number 2. Session number 3, then we're moving on to a cognitive approach to PTSD. We're going to walk you through kind of our treatment model and the 3 different stages of that, and moving from dealing with psychoeducation to the exposure stage to the post-exposure stuff, looking at ideas like moral injury and dealing with the numbness and dissociation, do some work with nightmares, restructuring cognitions that are associated with guilt and blame and shame, and look at the importance of relational healing, and a few other trauma and addiction-related coping skills, recovery-based skills to wrap you up as well. So that's, in general, where we're headed with the next 3 sessions.